Hey guys, this is Archana from Travel See Right channel, and today we are discussing the COVID 19 situation in India. India's COVID 19 tally has finally crossed 19.5 million cases with with approximately 400,000 cases on a daily basis, and the deaths are also about to touch 4,000 daily. So this number seems to be growing and growing. There seems to be no respite. But despite the healthcare almost on the verge of collapsing, there are some people who have been fighting day in and out to help the needy. They are helping them, whether it comes to arranging beds, oxygen cylinders, medicines, food. There is an army of these individuals who have come together to handle this crisis. And today we have another COVID warrior, or as I say, the unseen and unsung COVID hero. Swati D'Souza. Welcome, Swati. Swati started as a journalist, but she has been working as a researcher in the field of energy policy, and she has been playing a big role in activating the people all around and helping them. So let's hear more from Swati. Welcome, Swati.
Hi Archana, thank you so much. Thank you for your very kind introduction. I don't think I am a COVID warrior or or a COVID or a hero or any of that. I think people who are actually fighting on the front line and the people who have been running pillar to post to find resources should be given that credit. I am sitting in the confines of my home. I'm privileged enough to sit in the confines of my home and try and help as little, whatever little I can. So I don't think I am the warrior or a hero at this moment. I think we have there are too many stories of doctors and nurses and healthcare workers who are fighting this pandemic despite whatever personal problems or catastrophes they are facing. They are the real ones. I did start off as a journalist I worked with ET now for about 2.5 years. And then but my interest lay more in doing research. So I joined Terry in 2014, where I worked where I led the supply side research on fossil fuels transition. From there, I joined Brookings, which is now CSEP, in 2018, where I co-edited and managed a project on figuring the potential for natural gas in India. And now I lead the climate program at National Foundation for India, which has a very strong focus on just transition.
So, Swati, tell us how you got into helping other people. Like, what made you, chuck everything that you were doing and, try and help people which were coming from all walks of life? How did this whole process start, and what are you doing these days?
So this was somewhere around April, the second week of April, when things started getting really bad. I mean, we'd been hearing stories about it from Maharashtra in middle to late March, but it was in April that the crisis hit North India, particularly Delhi, UP, Chhattisgarh areas. And my Twitter timeline was inundated with desperate pleas for help in terms of finding oxygen, in terms of finding beds, in terms of finding medicines, in terms of finding any resources. And eh, I started, it was a little bit of a impulse decision because I couldn't just sit at the sidelines and watch people suffer. I mean, I thought I should do something about it. A friend sent a link for a bunch of volunteers who decided to come together and try and help citizens. So this was a citizen group, and so I joined that particular group. Um, Over a while, we decided to formalize the structure a little bit, and because the number of people who needed help was a lot more than what the numbers in that group could handle. So we sent out a request on social media using Google Forms. And we had a bunch of folks who joined. I think at last count, it was around 700 people volunteered to
Wow.
give their time.
And it was
Yeah.
across India, or was it just?
Yes,
Okay, it was across India. Okay.
it was pan India. And people voluntarily decided to give their time to helping finding leads on beds, on oxygen, um, on refill availability, on cylinders, on medicines. So that's how I got into it, because it was really difficult to sit on the sidelines and not do anything about it.
And how was this large group functioning? Because you mentioned like 700 people. So I'm sure the responsibilities, the roles would have been different. It won't be like all 700 people would be doing the same job. So, was there any kind of a process which was followed, to help people?
So we tried to institute a process, because it would have been pointless if all 700 would be doing the same thing. So we
Right.
tried to institute a process. We had separate groups for medicines, for oxygen, for beds, for ambulance, for testing. We decided to create a online. It was a Google sheet where all the leads where the database was basically created. And we had someone who would call 24 hours, someone who was there 24 hours, because um I'll be honest, the group didn't sleep at all. I don't think we slept in the from 15th April to, I think, last week. I think most of us were working close to 20 hours a day. So we had volunteers who would basically call the distributors, call oxygen vendors, to get a sense on availability, um, and then update the sheet and update people on the group saying this particular vendor has availability. For example, single gas agency in Faridabad. So on a Monday, when there were no cylinders available, one of our volunteers called and figured that these guys actually have cylinders, and that helped us for at least 4 days, because they had that kind of availability. So the thing is, because the availability changed at a very rapid pace, this process had to be dynamic. You had to keep having someone who could update the sheet throughout the day, who could figure availability out throughout the day.
You mentioned that a week back you were sleeping. Sorry, you guys were working up to 20 hours a day. So how has the situation changed? Has the situation improved or it has become worse? What has the government woken up? What's the change which has happened?
No, I don't think the situation has changed. If anything, I think it's deteriorated, because about 15 days ago, I would spend 2-3 hours on calling vendors, and I would get at least 2 to 3 leads on where cylinders are available or where refill is available. Now I have to spend close to 7 or 8 hours or almost an entire day to find one lead on one cylinder availability or a refill availability, and there is no guarantee that that's still going to be there in 2 hours or in 1 hour.
It must be very, very frustrating, like you're putting in so much of efforts, and when they don't yield any results, and you're not able to help people. You're trying your best, so it must be getting emotionally also very draining, right? So what do you do to keep yourself calm during those times? Because I think everyone we know is going through this turmoil. Everyone we know, there's either a death or somebody suffering in the family or known. So how do you keep yourself cool, during this time?
I mean, I don't have a formula as such. We each cope with uh, frustration and emotional distress in our own ways. For me personally, it's very difficult to say no to someone, and I feel extremely helpless when I have to find calls and I have to tell people, look, I'm sorry, I don't have any leads as of now. And it's very, very difficult to tell someone who is either crying on the phone or who is desperate that you can't help them. Um, I'm not sure I have been able to switch off because I did try to switch off for a while last week, but it's not really possible because especially if your number's gone viral, you still get calls, and then some cases are so bad that you have to take it up irrespective. So I'm still trying to switch off because it has gotten, I think now the problem is it's a law of diminishing marginal utility, because the number of leads and the number of resources has reduced to such an extent that you have more volunteers than you have resources out there. So, and almost all of them are calling up the same leads and they're doing the same process, because of which even the vendors on the other side have many of them just switch off their phones. So given that situation, it's not really possible to switch off at any given point in time, because you keep thinking you should be doing something. You keep feeling guilty about the fact that you're not doing enough. You keep feeling guilty about the fact that maybe if you would have tried a little harder, you could have saved someone's life, or at least provided them with the support that may have saved their life going forward. So I don't think I've been able to switch off despite wanting to switch off.
I think this tragedy is gonna leave really deep scars on us. It's gonna take a while for us to come out of it. But any advice or any message you want to give out to the people who are watching this, like what can they do to either help others or just to keep themselves safe? What can they do?
Please mask up. Please don't leave your house. This the system can't bear it anymore, and there is nothing available out there, despite all the efforts and orders by the High Court, by the Supreme Court. There is close to nothing available out there, and it's, I mean, if you get COVID today, there is a very high probability that you are not going to be able to get resources, even if you have the money to throw at it, So please just mask up and stay at home and don't step out for anything, just because this peak has to fall. And especially in NCR, UP, I mean, I don't even go by the numbers that are out there anymore, because everyone knows that these numbers may be fudged, or the data point may be missing. So don't take these numbers at face value. It's not like I'm trying to create panic. I'm just saying that resources are very, very scarce, and it's going to take a while for your supply side production to ramp up. It's going to take a while for the supply chain to be able to ramp up production. I mean, you can have oxygen, which is what a lot of countries are donating, but where are your cylinders going to come from? Do you have enough? Right now, the problem is what everyone, many families who were not affected, who have now become affected, are unable to find oxygen cylinders, because production has not ramped up. So you may have refills. There are a lot of refills happening, but you don't have cylinders. So what are you going to do about it? So it takes time for supply chain and logistics to ramp up. So please, if you can, do not step out. If you can, stay at home. Just stay at home.
Yeah. And if possible, if possible, vaccination is available and you qualify for it, then people should definitely get vaccinated, because that is what is probably going to
Oh
save.
yeah, I mean, I fall in the category of 18 to 45 years old, and I haven't been able to find a slot for vaccination
Yeah.
in Delhi. I mean, there were a few slots that were opened up on Friday night, I believe, but before I could go, by the time I went online to look at it, all of it was booked. So if you are in the age group between 45 up, please go get yourself vaccinated. If you are in the 18 to 45 age group, try if you can get yourself vaccinated now, or the best way is to double mask, to maintain social distancing, to actually follow quarantine rules, because what is invariably also happening is if someone in your house has COVID and you don't take adequate precaution, you are we're seeing a lot of families who are falling to COVID because of that. Um,
Yeah. Thanks a lot, Swati. Thanks a lot for taking out time and speaking to us. I'm sure many people who have
no
seen
problem.
this, would get to know the current situation on ground, and thankfully, if you can keep yourself, from the COVID infection, try and do that. And wish you all the best, and please stay safe. Take care. Bye. Thank you.